Hello everyone, Dr. Beth, and welcome to another episode of The More You Know Heart Disease. So this week we're going to focus more on strength training. And I think it's really fascinating because even though there's a lot of evidence supporting the benefits of strength training to help prevent heart disease and or manage heart disease once you've developed it, it often gets overshadowed by cardiac exercises. And if you think about a traditional cardiac rehab program, there's not a lot of resistance training in it. It's a lot of the walking and the bike pedaling and the arm circling, all of those kinds of things. So benefits of strength training include, surprisingly, strength training also improves your VO2 max. Remember from last week's video that that's the gold standard to measure your cardiovascular fitness. So you can do your cardiac exercises like your endurance training, but you can also do strength training to improve that VO2 max, which is really exciting. But other benefits that are more specific to strength training in particular are it's going to improve your muscle strength and endurance. And of course that makes sense. But I think what people don't often realize is once you have heart disease, you're probably moving and exercising less, and you're at an increased risk for losing your muscle strength and mass. And what happens is when you go to lift something heavy and you're really weak, you're at an increased risk of triggering a cardiac event from all of the pressure of trying to lift or move something heavy. Strength training will help to combat the fragility and the frailty that often comes with cardiac disease. And what they've actually found is that people who have strength training in addition to their endurance training actually report a better quality of life and improved psychological well-being because they're able to maintain their mobility in addition to improving the health of their heart. And then again, we've talked about this last time, the ejection fraction, which is how much blood the heart pumps out every beat, also improves greatly with strength training. Now, what the research has shown is that light weights are not going to give you these benefits. The best benefits come from a high load or a heavy weight, but that's not something that you would jump right into, especially after an acute event. So especially after a heart attack or a flare-up of heart failure, you wouldn't jump in with heavy weights immediately. But with a progressive resistance training program, we would start you at a low weight and every week or two kind of bump up that weight and then strengthen your body as it's able. So strength training alone is not the recommendation for preventing and managing heart disease. It is a combination of the cardiovascular training and the strength training that's going to give you the best benefits and give you a more comprehensive program than cardiovascular or endurance training alone. And again, if you've just had a recent cardiac event, please seek out medical supervision when starting a program. But let's make sure that you're not only focusing on the endurance training, that you're adding a little bit of strength training in there to improve your quality of life, maintain your mobility, and maximize your recovery or maximize your ability to prevent heart disease.